Early pregnancy includes the preembryonic period, which is fertilized ovum implantation around week 1. Next is the embryonic period, where the fetus's organ systems begin to develop and teratogens should especially be avoided. Fetal maturation begins around week 9 until the end of pregnancy. The placenta provides the baby with nutrients, antibodies, and oxygen to the baby, as well as filtering waste products. It forms quickly after implantation. The umbilical cord forms around the 5th week of development and has 2 arteries and 1 vein. Antenatal testing includes blood group and Rh, rubella titer, hepatitis B titer, gonorrhea and chlamydia cultures, HIV, ultrasound, and weight and urine. Each prenatal visit includes weight, urine dipstick for protein, glucose and drug abuse, fundal measurement, fetal heart rate, and to ask mom if baby has been moving and if they have any questions or concerns. Pregnancy includes 3 trimesters. Trimester 1 is conception to 12 weeks, the second trimester is 12 to 26 weeks, and the third is 27 to 40 weeks. To calculate due date, Nagli's rule is used. Take the first day of the last menstrual period, minus 3 months, and then add 7 days. For fetal well-being, nurses will provide information but will not advise. Amniocentesis tests for fetal abnormalities such as trisomy 21 and neural tube defects will be done. There are also non-stress tests done to monitor heart rate. The next few clips will show the nurse-patient interaction for antepartum.
Hello, Grace.
Hi.
I'm leaving for the day, so I'm going to give a report to Angel.
Okay.
So we have a 30-year-old G1P0. She's 38 weeks gestation. No known allergies, GBS negative, rubella immune, blood type
A positive.
So she's Rh
A positive.
does not need a Rogaine shot. She came in at 4:30 this morning with mild contractions, and she's 1 centimeter dilated. No history of drug use or teratogens, and fetal monitoring shows accelerations. She's now 3 centimeters dilated, contractions are 3 minutes apart, and have been going on for about an hour. We are anticipating spontaneous vaginal delivery.
Okay, sounds great. Thank you. What were the results of her gonorrhea and chlamydia?
Both are negative, and she has a urine dipstick test in 1 hour.
Perfect. Hi, Grace.
Hi.
I'm just checking in to see how you're doing. Are you in any pain right now?
I am in a little bit of pain, like right above my belly button. And I have been having headaches, and like the lights are really bright too.
Okay. Could you rate your pain for me from 0 to 10?
I would say like a 6 or 7.
And right here you said above your abdomen?
Yeah.
Alright, I'm just gonna check you out.
Okay.
It does look like your legs are a bit swollen. Do you know how long they've been like that?
Like 3 days.
Okay.
Yeah. It's
I'm just
been
gonna-
hard to like walk too, kind of. So.
It's hard to walk?
Yeah, with
Alright.
the swollen legs.
I'm just gonna check your blood pressure.
Okay.
So it does look like your blood pressure's a little high. It's 146/92. What's your usual baseline?
Yeah, like 120 over like 70s. 120
Okay.
over 70.
I will talk to the doctor and we'll figure out what's going on with you, and we'll monitor your symptoms, and hopefully that pain will go away.
Okay, thank you.
Hi, Dr. Smith. I'm calling about Grace, mom in room 4. She came in today at 4:30 a.m. 3 centimeters dilated, contractions 3 minutes apart. She is G1P0 at 38 weeks. Her blood pressure was 146/92. She has swollen legs, headaches, epigastric pain. The urine analysis results showed protein in her urine. The CBC came back and the platelet levels were low, and the hematocrit was high. All of these tell us that the patient is preeclamptic. What do you suggest we do?
Hi, do we have any updates on Grace?
We do. So she did show signs of preeclampsia. I talked to Dr. Smith and he put in orders for magnesium sulfate.
Okay, great. So we're gonna monitor her reflexes, her epigastric pain, and her blood pressure. We can even review the protocol and notify Dr. Smith if we need to.
Sounds good.
This is magnesium sulfate. This is just preventing seizures from the preeclampsia.
What's preeclampsia?
That is when you have hypertension, which we found. You have protein in your urine. So we just want to make sure that you don't have a seizure, and this is just going to prevent that.
Okay, perfect, thank you.
During labor, there are 4 stages. The first stage includes dilation, where the cervix must dilate 10 centimeters, and this is the longest stage. The cervix first ripens, then dilates and effaces, and the fetus starts to descend. It is important for mom to keep her bladder empty, as otherwise it can cause a soft tissue obstruction. The nurse's main role during this stage is mom and baby's safety, comfort, fetal heart rate, contractions, pain management, and support. The second stage is the stage of expulsion, or the pushing stage. The third stage is placental expulsion, or the delivery of the placenta 5 to 10 minutes after the baby is delivered. and the fourth stage is the recovery stage, where mom is monitored especially for uterine tone and signs of hemorrhage. The 3 behavioral phases of labor include phase 1, or the latent phase where mom is sociable, phase 2, or the active phase where mom gets more serious and pain may start increasing, and stage 3, or the transition stage where mom gets more irritable. Essential factors in the labor process are the passenger, or the baby, the passageway, the pelvis, powers of contraction, and psyche, or mom's will. During intrapartum, it is also important to monitor for vena cava syndrome. Vena cava syndrome is when the inferior vena cava is compressed and mom should be laying on her left side. We also want to monitor fetal strips and complete a fetal assessment. The normal range for fetal heart rate was 110 to 160. Accelerations are good. The next few clips will discuss postpartum.
Hi, Mom.
Hi.
Congratulations.
Thank you.
Your baby's beautiful.
Thank you. Yes, he's so good. I named him Henry.
Oh, I love
He's
it.
so cute.
How's he doing?
He's good. He's been crying a little, but I've been trying to soothe him. I heard that this is a good way to soothe him.
Oh yeah, when you're holding your baby, make sure you're not like sleepy or anything. You're not falling asleep.
So Henry's doing great, right? Especially right after delivery. His APGAR score was 8 at 1 minute and then 9 at 5 minutes. So that means he's doing good. And then we're just gonna do a quick assessment to see how you're doing.
Okay. Yep. So I'm gonna take him from you and put him in the crib.
Okay.
He's gorgeous.
Thank you.
Okay. Okay. So quick assessment on you, Mom, real quick. How are your breasts feeling?
They're good. They're a little tender. I haven't breastfed yet.
Not feeling full or anything yet?
A little full, but
Okay. I'm gonna look at them real quick.
okay.
All right, and I'm gonna take these blankets down for a minute. I'm just massaging your uterus. Are you bleeding a lot?
I had some bleeding. I had some bleeding.
Okay, so it seems like it's right where it's supposed to be at the umbilicus. Have you had a bowel movement?
Not yet, no.
Okay. Are you passing gas?
A little, yeah.
Okay, good. And how are your pads are looking? Are they red?
Yeah, they're a little red.
Still red? Okay, that's normal. And then we'll check you out down here. Any pain?
No pain.
Okay, that's good. And how are you feeling? How are your emotions?
I'm doing
Are
good.
you good?
Feels so weird to be a mom,
Yeah.
but I'm okay.
Okay.
Yeah.
There is something we'll have you fill out to see your risk of postpartum depression.
Okay.
There's a little checklist that we'll have you fill out. I'll bring that in later.
Okay, sounds good.
Okay.
Grace, how are you doing?
I'm doing good. I'm okay.
Okay. How are you feeling emotionally?
I'm just worried to take him home, honestly. I never had a kid before. It's my first baby, so.
So you're a little bit worried about safety with the baby?
Yeah, and the connection between us.
Okay. So one really important thing we tell moms, there's a really easy way to remember how to keep your baby safe, the ABCs. So A, you want to make sure your baby's alone in their crib. B, you want to make sure that he's sleeping on his back. And then C, when he's in the crib, no fluffy blankets, no stuffed animals, make sure his mattress is firm. All of that'll keep. Another thing I wanted to talk to you about was the pamphlet that you filled out for us. It looked like you were feeling a little depressed since your delivery.
Yeah.
Okay, can you tell me a little bit about that?
I don't know. I just feel like I'm not gonna have a connection with him, and like I just feel weird having a baby. Like I don't know, 9 months. It's like this was in my body.
Okay, well, definitely. So we're gonna actually have a breast consultant come in and talk to you about that connection. But in the meantime, it's actually normal for that feeling to last for a few weeks. We call it postpartum blues. But if it develops and stays for a few months, that's when you want to give us a call so we can figure out some other things. Okay. All right. Thanks for
Hi,
letting me.
Mom. How's breastfeeding going?
It's going okay. I've only breastfed once. Like he only took it once.
Okay. You can try pumping too if that's something that you've been thinking about.
Okay.
And you just want to make sure you're feeding every 2 to 3 hours, even if he's sleeping. You're definitely going to want to wake him up so that he's eating, because he needs to eat and grow and everything, and then also so you're getting that milk supply out. Okay, you've been taking your prenatals?
Yeah, I take folic acid. The doctor told me it was good to prevent brain and spinal cord defects.
Yeah, just make sure you're taking them throughout your breastfeeding time to keep getting that nutrients into the baby.
Okay.
And we have our lactation counselors here if you need further resources.
Okay.
Okay?
Yeah, thank you.
Alright, sounds good.
Postpartum is the period from delivery of the placenta until 8 weeks. During this time, mom's body is returning back to a pre-pregnancy state. Hormones are regulating, and it can take up to a year for them to return back to normal. Increased temperature and increased white blood cell count is normal during this time. Coagulation factors also return to normal. After delivery, the uterine height is typically at the umbilicus and decreases in size 1 centimeter each day. Mom will lose approximately 200 to 300 cc's of blood. The focus for mom's assessment is to look at her episiotomy or her C-section incision scar, hypercoagulability factors, checking for any signs of DVT, assessing uterine involution, keeping the bladder empty, monitoring breast changes, considering mom's blood type, any signs of hemorrhage, and mom's emotional status. After delivery, prolactin levels begin to rise, which causes milk production. The first milk is called colostrum. It has antibodies and proteins needed for the baby. When mom breastfeeds, it causes uterine contractions. Newborns should be breastfed every 2 to 3 hours around the clock. Concerns for breastfeeding include engorgement, blocked ducts, and mastitis. If mom chooses to bottle feed, she should wear a tight, supportive bra, apply ice to the breasts, and she should not stimulate her breasts.
Another important topic to consider with pregnancy is how the experience can be affected if the mom has a disability. Pregnant women with a disability have to collaborate care between a number of providers for it to be successful. With appropriate disability management, labor and pregnancy of a disabled woman can be very similar to the pregnancy of a non-disabled woman. After birth, women with disabilities will likely have a much longer and more difficult recovery and need extra planning for breastfeeding and childcare.